This is Joseph Randall. He's a chiropractor at West Texas Back Clinic. He also has his BSN, and we're going to get his holistic perception on clinical nutrition. How important is nutrition in the clinical setting?
I believe nutrition is very important, not only in a real life setting, but in a clinical setting as well. The reason being is that in a clinical setting, you'll have patients oftentimes come in asking questions about a certain supplement, or how much they should be eating or drinking of certain things, and so to have a basic or a really good understanding of nutrition is very important, because the patient is coming to you for answers. They're paying you for your time, and so you want to make that time worthwhile, and therefore give them the best advice and the best nutritional counseling possible. So.
All right. Do you feel that providers should have an education in nutrition?
I do. Not only holistic providers like chiropractors, but even medical doctors. It kind of ties back into the first question, but even for, say, a medical doctor, if they've got a patient who's on a certain medication, they need to understand that nutrition can affect certain medications, efficacy, or the amount of that medications can be effective for the patient. Also, it's very important because, like I said before, the patient's going to come in asking you about a certain nutrient or something like that, and so the doctor needs to understand nutrition so that they can help guide that patient in their kind of journey to health and wellness.
Mm-hmm. Can you give some examples on how you use nutrition when treating patients?
I can. Good example, patients a lot of times, coming to me will have inflammation, pain, and so whenever I see them, of course I can't, as a chiropractor, prescribe medication, but what I can do is I can tell them what they may want to take to help fight, inflammation or pain, muscle spasms. So there are certain natural over-the-counter things that they can take. For example, omega-3 fish oils, which have EPA and DHA in them, can help not only fight inflammation, they can also help maintain the integrity of the inside of the blood vessels, so on and so forth. After a manipulation or an adjustment, I'll often tell them to increase their water intake, because during a manipulation, you're affecting soft tissues. So with the increased water intake, that's going to help to kind of flush out toxins like lactic acid out of the muscles, and help kind of decrease a little bit of their soreness and stiffness. So.
While in school, how much attention was addressed to nutrition?
In chiropractic school, and nursing school as well, we did get a lot of nutritional education, just due to the fact, like I said, we as chiropractors still considered Port Elementary providers, so patients may not have a primary care provider, so if they're coming to us, then they're going to rely a lot on our nutritional counseling and advice. So.
Okay. How much clinical nutrition education do you have?
I think I have enough nutritional education to be confident in whatever somebody may ask me about, and if I don't know the answer, then I tell them I'm not sure, but I'll find out for you. And there are certain times I have to go back and review a couple things, but for the most part, I've got enough under my belt to be content. So.
What is your stand on medication versus nutrition?
Like I said before, I can't prescribe, but I do think that there has to be a good balance. Because, for example, somebody may have diabetes, or may have heart disease or cancer, and you can help these conditions with nutrition. You can help some of their problems, but you're not going to completely take away, say, prostate or lung cancer with nutrition. So that person's probably going to be on medication as well. But with certain medications, the same holds true in the fact that the person's going to need to probably intake, or increase their intake of certain nutritional components in order to, whether it's fight fatigue or something like that. So.
All right. Well, I appreciate your time. Thank you very much.
Thank you.